Okay, Matthew Holt, THCB, a lightning round with Isabelle Kenyon. She is the CEO of Calibrate. Isabelle, what is Calibrate?
Calibrate is a modern metabolic health business changing the way the world treats weight.
That sounds good. What does that mean in English?
Calibrate's first product is a one-year metabolic reset that we sell to consumers. The product combines medication, coaching, and a lifestyle intervention delivered electronically.
All right, so these are some relatively new medications. How do they work, and how does the wraparound of the coaching, how does that work for a patient who's signing up?
The medications we use today are called GLP-1s. Calibrate's a platform, so we'll always use the most effective medications in the market. The wraparound is about combining intensive lifestyle intervention with a GLP-1. Intensive lifestyle intervention has been researched for decades and is a structured program to help you change the way you eat, sleep, exercise, manage your emotional health.
All right, so if I'm a patient, what do? I find Calibrate somehow, and then what happens next?
You see if you're eligible to join Calibrate based on the FDA label for the medications. You sign up to Calibrate today. You pay us for the cost of the service of participating in Calibrate. You go get your lab work done. You fill out a health history questionnaire. You see your Calibrate doctor, and you start working with your Calibrate coach through weekly video visits.
All right. So the doctor is your doctor, not my doctor.
Calibrate employees.
Right. And then, are typically the patients you're signing up, are they being treated for for obesity or weight issues separately by their doctors? How does that part work?
Primarily, we treat obesity and overweight, and they still see doctors for any other comorbidities like diabetes.
So you're essentially a vertical link for that. And how many of the patients you're working with have got something like diabetes or some other comorbidity like that?
More than 80% have comorbidities, and about 65% have diabetes or prediabetes.
All right, so you're working with them. Now, these drugs are pretty expensive. The patient is not paying for those drugs, but they are, presumably, we've heard it historically, the health plans haven't always been that keen to pay for expensive drugs. I understand these drugs are sort of several, over $1,000 a month. So how do you work with that, and what's the sort of state of play in the market regarding the cost of the drugs and the value of them?
The efficacy of Calibrate really comes from the ability to navigate towards the drug that is the lowest cost to the payer so that we can increase access the most for the consumer. And so figuring out which of those drugs discounts the most to the PBM so the PBM gets it back to the employer or the ultimate payer, and making sure that we get the patient onto that medication so that they can have access for the amount of time that their doctor thinks is necessary to drive long-term sustained weight loss.
All right. Regarding, Now you've run the outcomes. You've been doing this. You started people on the program in 2020, right? And
June 2020.
So you're now sort of 18 months in. You've got some data there. How many patients you had on, and what kind of results have you seen?
There are about 15,000 members in the program today. We published our first year results in January. The average member lost 15% of their body weight. They lost more than 6 inches from their waist circumference, which is the CDC's measure of metabolic health. And we saw dramatic improvements across other metabolic markers like triglycerides, A1C. 78% of people with pre-diabetic or diabetic A1Cs reversed.
So that should theoretically be one of these things where it's it costs some money, but it should hopefully save money down the road. Now, traditionally, health plans and employers haven't really worried too much about that. How have you been so successful in sort of getting going from nothing when a lot of people had these great ideas and haven't been so successful?
I think there's two big shifts driving it. The first is just how consumers, by the way, are doctors. They work at health plans. They're benefit managers. Think about obesity, especially following COVID, how they think about obesity as a disease, how they understand that obesity is biologically driven, genetically driven, hormonally driven, and want to start treating it that way. And so I think we see like some tailwinds from that side of the business, and then some tailwinds from just the macro environment around the Great Resignation and employees wanting benefits that add value to their lives, and employees wanting to stay at businesses that are providing those benefits, right? Amazon just started paying for 4 years of secondary education for any employee who's worked there for 3 months. It's pretty crazy.
Excellent. All right, so you guys raised a big number, and I can't remember what it was last summer. So tell me about the total funding so far and give me a sort of sense of the scale of the company.
There's about $125 million of equity into the business. The business did about $17 million of revenue last year, and will do about 4 or 5 times that this year.
That sounds very exciting. And how many people are you? And give me the split.
500 people on the team.
Wow. 500 people, and then how many providers, how many coaches? Give me a sense of the people touching the patients versus
Off the top of my head, I think it's about 100 doctors, about 200 coaches, and about 200 people on the member experience and service teams.
Fantastic. And if I came back here next year, you just said you mentioned the 5 times increase. Give me a sense. You're in a lot of states now. Give me a sense of how many people what is a good number for
Goes
number
to
of
50
patients?
next year.
Sorry?
50,000
Okay, 50,000.
in 2022.
My guess is of Americans who have a BMI above, you said 30 or 27, there's a few more than 50,000. So I guess this market,
About 200 million of them, yes.
this market is open. All right. Well, I'm looking forward to seeing how that comes out.
Thank you.
Talking with Isabelle Kenyon. She is the CEO of Calibrate at the conference. It's a Digital Health Conference.
Innovation Summit.
If I can remember the name of the conference, Digital Innovation Summit in San Diego. Isabelle, thanks for your time.
Thank you.